being here and joining us at our ARC Cancer Hospital. And as Mr. Shrikant said, that we would be talking a little about global trend, where we stand today as per cancer incidence and everything. ಅದು ಇವತ್ತಿನ ಕಾಲಕ್ಕೆ it is extremely relevant, especially because in India and Asian countries we do see a very high incidence of cancer. I'm sure this is almost common language, common WhatsApp alagli, in common conversations alagli, and even among your family, friends, you would have heard cancer being so common these days than compared to what it was a couple of years back. And this is probably very true because just yesterday, WHO has released a cancer global burden status report. So as per that report and the current incidence as of today, it is quite alarming for all of us to know that 1 in every 5 individual worldwide is going to get cancer between 0 to 75 years. So that is quite a alarming incidence rate and the increase that we have seen in the last 2 decades. ಅದಕ್ಕಿಂತ ಜಾಸ್ತಿ ಇನ್ನೊಂದು ಅಲಾರ್ಮಿಂಗ್ ಸಿಚುವೇಶನ್ ಏನು ಅಂತಂದ್ರೆ ವಿ ಆರ್ ಸೀಯಿಂಗ್ ಕ್ಯಾನ್ಸರ್ ಅ ಲಾಟ್ ಇನ್ ಯಂಗರ್ ಅಂಡ್ ಪ್ರೊಡಕ್ಟಿವ್ ಏಜ್ ಗ್ರೂಪ್. ಸೊ ಪ್ರೊಡಕ್ಟಿವ್ ಏಜ್ ಗ್ರೂಪ್ ಅಂದ್ರೆ ವಿ ಆರ್ ಸೀಯಿಂಗ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಇನ್ 20s, in 30s and 40s. And why this is extremely important for our community, and mainly because this is the age group where the patient, they form pillar for the family, they form pillar for the community. Why? Because they're taking care of their children, they're taking care of their parents, and they are the main breadwinners for the family. And when such a person gets affected by cancer, the whole family gets affected. So, ಈ ತರ ನಾವು ಇನ್ಸಿಡೆಂಟ್ಸ್ ಇದು ನೋಡಿದ್ರೆ almost 90% of the family, like as totally together, are going to be affected either by cancer directly or indirectly. So ಇಷ್ಟೊಂದು high numbers ಇದ್ದಾಗ what are we doing as doctors? Sometimes that is something that we have to question us also. It is also extraordinary for oncologists ಆಗ್ಬಿಟ್ಟು ನಮಗೆ ಏನು what is more extraordinary is that today we are heading more towards into precision oncology. Things like immunotherapy, ಮುಂಚೆಲ್ಲ ನೀವು ಕ್ಯಾನ್ಸರ್ ಅಂತಂದ್ರೆ stomach cancer stage 1 to 4, that is something that we all know and that is something that everybody's heard of. But since the last 2 years maybe, that is completely changing onto molecular footprint of each and every individual tumor. So ಪ್ರತಿ ಒಂದು ಟ್ಯೂಮರ್ಗೂ ನಾವು ಟ್ಯೂಮರ್ ಮಾರ್ಕರ್ಸ್, there are various predictors, ಬೇರೆ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಬಿಟ್ಟು every tumor today and every patient today is treated differently. They're not only treated based on the stage or based on the subset that it affects. Why are we doing this is because we have seen lot of advancement today in chemotherapy, in immunotherapy, and also surgery is also getting more and more precise with robotic surgery, and we have more better reconstruction facilities today, we have better rehabilitation. So when I spoke to you about a middle-aged person who is getting affected cancer, or very survival ashte important alla, we want that patient to go back to the family, we want that patient to go back to the society as what they were before they got the cancer. So ee tara ನಾವು patient, if we have to send them back to the community at their fullest potential and at their fullest production ಅಂತಂದ್ರೆ ನಾವು ಅವ್ರಿಗೆ we have to give them the full range of cancer treatment as it is available today. I would hand it over to Dr. Srihari and Dr. Dinesh, who will tell you probably how we are trying to connect all the dots and how our treatment philosophy is based on.
Thank you.